Cardiopulmonary resuscitation, CPR. Guide CPR is an emergency life-saving procedure performed when the heart stops beating. Immediate CPR can double or triple the chances of survival after cardiac arrest. Basic CPR steps for adults, hands-only CPR. 1. Check responsiveness. Tap the person and shout, "Are you okay?" If no response, call for help and activate emergency services. 2. Check breathing. Look, listen, and feel for normal breathing for no more than 10 seconds. If the person is not breathing or only gasping, begin CPR. 3. Call for help and get an AED. If available, call emergency services or ask someone to call. If an automated external defibrillator, AED, is available, use it as soon as possible. 4. Begin chest compressions. Place the heel of one hand on the center of the chest, lower half of the sternum. Place your other hand on top and interlock fingers. Keep elbows straight and shoulders directly above your hands. Press hard and fast, at least 5 centimeters deep, at a rate of 100,120 compressions per minute. Allow full chest recoil between compressions. 5. Use an AED. If available, follow voice prompts from the AED. Apply pads and deliver a shock if advised. Continue CPR immediately after the shock. CPR with rescue breaths, traditional CPR, for healthcare providers or trained individuals, perform 30 chest compressions. Open the airway, head tilt, chin lift, and provide 2 rescue breaths. Continue cycles of 30 compressions and 2 breaths until help arrives or the person shows signs of life. CPR for children, 1 year to puberty, perform 30 compressions plus 2 breaths. Use 1 or 2 hands for compressions, depending on the child's size. Compression depth, about 5 centimeters, 2 inches. If alone, perform 2 minutes of CPR before calling emergency services. CPR for infants, under 1 year. Check responsiveness and breathing. Use 2 fingers, not the whole hand, for chest compressions. Compression depth, about 4 centimeters, 1.5 inches. Perform 30 compressions plus 2 gentle breaths. When to stop CPR? The person starts breathing normally. Emergency personnel arrive and take over. You are too exhausted to continue. A trained professional declares the person deceased. Would you like a specific CPR technique, e.g., drowning, pregnancy, or trauma-related CPR?